Okay, good morning, everyone. Welcome to today's Talk with a Doc, all about skin cancer with Dr. Keasha Guerrier. My name is Brooke Oliveri. I am the manager of the Long Island Health Collaborative. For those of you who may not know, the collaborative is overseen by the Nassau-Suffolk Hospital Council, and we are a group of 300 plus hospitals, health departments, community-based organizations, and private businesses from really all sectors, all working toward improving the health of Long Islanders in the best ways we can. So many thanks to our sponsor, AARP New York, and many thanks to Dr. Keasha Guerrier of Long Island Jewish Valley Stream Hospital for taking some time out of her day to educate us about skin cancer today. Some housekeeping before we get started. Luckily for those who registered and maybe couldn't join us live this morning, the program is being recorded, and by participating, you are consenting to being part of the recording. So thank you for that. We will have some pre and post-event poll questions for our live attendees to answer, and we will have an interactive Q&A session with Dr. Guerrier after her presentation. So please hold your questions until the end, or feel free to put them into the chat and we will make sure that they get answered. Before I turn it over to Dr. Guerrier, I'd like to introduce Rosa Jordan, an AARP virtual volunteer who will share some information about AARP. Take it away, Rosa, whenever you're ready.
Thank you. Hello, my name is Rosa Jordan, and I am an AARP volunteer, and I live in East Meadow. On behalf of AARP New York, welcome to today's Talk with the Doc virtual wellness webinar. We are committed to helping you stay connected, so we congratulate you for taking the time to grow, create, and learn with AARP and the Long Island Health Collaborative. As you know, AARP is a nonprofit, nonpartisan membership organization for people age 50 and over. There are 38 million members nationally, 2.4 million in New York State, and close to 500,000 members living and working right here on Long Island. AARP works to strengthen communities and advocate for what matters most to people 50 and over and their families, with a focus on health security, financial stability, and personal fulfillment. Here on Long Island, AARP staff and volunteers work together to ensure our community is a healthier, friendlier, more livable place to work, play, explore for people of all ages, and work closely with community stakeholders to make our community an even better place to live. Learn more about other online classes, virtual events, local discounts, volunteer opportunities, and more at aarp.org/local. Thank you for joining us today.
Thank you so much. Excuse me. Thank you so much, Rosa. And once again, thank you to AARP for sponsoring this series. It's been an absolute pleasure to work with you and them. So before I introduce Dr. Guerrier, as I mentioned, we do have some pre-event poll questions for attendees to answer. I'm going to go ahead and launch those right now. If you wouldn't mind just giving us your feedback, it's very helpful for us to gain some insight into your state of mind before attending a program like this, and to learn a little bit more about you and how we can better tailor our programs to fit your needs. So we would love to hear your feedback if you'd be willing to give it today. I see some answers coming through. Thank you all for your participation. And reading some of these, I know you might think, I'm not really sure if I'm ready to adopt some of the tips shared in today's program because you don't know what they are yet. But that's kind of the point of these questions. We want to gauge your impressions before and after. So thank you for providing that feedback. It's been about a minute here. I'll give it maybe 20 more seconds. I know the questions are kind of lengthy here, so thank you so much for taking the time to respond. Okay. 10 more seconds, I will close out the poll. Okay, thank you all so much. I'm going to go ahead and close the poll. All right, and now the moment you've all been waiting for, I would like to introduce Dr. Keasha Guerrier. She is the chair of the Department of Family Medicine at Northwell Health's Long Island Jewish Valley Stream Hospital, and she is also the director of the New York State Academy of Family Physicians. In her work at the hospital, Dr. Guerrier works with leadership to drive patient care improvement, safety, and quality of care. And she spearheaded the clinical efforts to directly impact patient survival during the recent COVID-19 surge. In her role under the Northwell Health System, she also serves as Senior Project Manager for the Institute for Clinical Excellence and Quality. And just from my personal experience with her, I know that she is a wonderful community champion who is always willing to, educate our community and participate in events with our community. So we thank her for, being with us today. And without further ado, I would like to hand it over to Dr. Guerrier.
Thank you so much for the introduction, Brooke, and welcome to everyone who's here. Looking forward to sharing some information, answering any questions. As Brooke said, to reiterate, just pop them in the chat or we can talk about them afterwards. So I'm going to be talking a little bit about skin cancer, and I really want to hone down on melanoma for a couple of reasons, but I just wanted to kind of give the basic overview of skin cancer in a nutshell. So we know that cancer is any disease in which cells in our body proliferate or kind of replicate themselves very rapidly. When that cancer starts in the skin, we call it skin cancer. Prevalence in the United States, there are top box 3 cancers that we really struggle with. So it's a basal cell carcinoma, a squamous cell carcinoma, or a melanoma. And these 3 cancers are actually, they're named for the location where they start in the skin. So a squamous cell would be superficial, a basal cell, think base layer of the skin. And then the melanoma is actually the pigment forming cells, which are deep, in the dermal layer of the skin. Very, very common. Our risk factors for them are involved with, UVA and UVB rays, either artificial or natural sunlight. But with regards to basal cell and squamous cell, those are cancers that I would say are more easily not only diagnosed, but also controlled. With a basal cell, those are cancers that can be scraped off, they can be excised by your dermatologist, and usually respond to very local treatment. I wanted to bring up melanoma because it has the highest death rate of all types of skin cancer, and it's most likely to spread or metastasize throughout the body. It's actually one of the most frequent occurring cancers in young adults from 20 to 30. And the risk factors for it follow along the same lines as the risk factors for both squamous and basal cell carcinomas. So sun damage, both natural and artificial. So tanning beds or just exposure to the sun. Also, some other risk factors are folks that tend to have a fairer complexion, or who have a tendency to burn in the sun or to increased risk. Anyone who's had a previous melanoma, a family history of melanoma, or having a lot of moles, which we also call nevi, those are also risk cancers. I would also say and underline here that a history of peeling sunburns is the main risk factor for melanoma, and that artificial sunlight from tanning beds causes the same risk for melanoma as natural sunlight. We can advance to the next slide. For folks who can see these slides, I really wanted to make an effort to bring this to light. For a lot of disease states, we talk about what are the warning signs. So a lot of people know the warning signs of a heart attack, chest tightness or difficulty breathing. People know the warning signs for a stroke, decreased strength or facial droop. Sometimes we don't know what are the warning signs for skin cancers and melanomas, and what are some things that we can look at. So I want to kind of go through the appearance. And for that, we have a very easy acronym, ABCDE, where each letter stands for something that you would look at and know that there's an abnormality. So when we're talking about, when we talk about this appearance, we talk about the symmetry. So A is for asymmetry. Most benign moles are symmetric. When you have an asymmetric mole, so something that has more of pigmentation on top or on the bottom, that's a signal of concern. The borders of normal moles are usually even. If they're raised, they're circular or square or oval, but the borders in melanomas are usually irregular. The color of moles that are benign or quote unquote safe, non-cancerous, are usually one color, whereas with melanomas, you'll have multiple colors, multiple gradations of color in that one mole. And those, again, are signals for concern, things that you should escalate to your doctor or dermatologist. When we talk about the size of the diameter, so smaller than 1/4 of an inch are usually, those sized moles are safer. When moles get larger than 1/4 inch, those are ones that you want to have more closer follow-up with. And then E stands for evolving. So if you have a mole that's changing in shape, changing in size rapidly, becomes ulcerated, becomes something that looks more like a lesion or cut, those are some things that you definitely want to take a look at and have evaluated by a physician. The other thing that I wanted to bring to light are common areas, right? So we always tend to think, okay, when I burn, because I actually do both burn from the sun, it's usually on my nose, on my cheeks, on my shoulders, and I think those are common areas around the back, common areas for sunburn. So in common areas to find melanoma in fair-skinned men, or men in general, are on the trunk area, right? So on the chest, belly, front side. In women, fair-skinned women, it's usually the lower legs that the melanoma appears. And in darker skin toned folks like myself, usually the palms of the hands, the soles of the feet, or underneath the skin of the nails, which is why it's very important to always, we can move to the next slide, do a self-evaluation and know how we keep ourselves safe. So I would say that the top box item with regards to keeping ourselves safe are to use sunscreen that protects against UV radiation. Now, the most UV radiation actually happens between 10 a.m. and 4 p.m. So that's when you're getting the highest incidence of UVA and UVB. I also want to say that when you have cloud cover, so when the sun is not directly shining over you, but there's actually cloud cover, you actually have more penetrance or more penetration of UVB rays that are harmful. So even though it's a cloudy day, you must still, if you're outside around those times, definitely want to be wearing sunscreen. And avoid staying out in the sun for long periods of time, especially when the sun is at its strongest between that 10 a.m. and 4 p.m. Or wear long sleeve shirts, long pants, sun hats, sunglasses when outdoors, especially if you're going to be gardening, walking, and enjoying the elements. And then for those with many moles, yearly skin exams are recommended. I also strongly recommend self-examination and yearly examination if you have any moles on your body. One of the things that I learned earlier on, actually, my eldest sister died of a melanoma, which no one really thought about. It was on her lower leg. It grew very rapidly. Melanoma is a very, very rapidly progressing cancer. And when it was caught, it had metastasized. But that provoked me to go to a dermatologist each year until they said, okay, whatever we're seeing looks pretty stable. You can continue, your follow-ups, do your self-examinations and follow up later. But I was really impressed with how the examination itself. They literally look at every single skin surface. So things that you don't think about looking at, between the fingers, underneath the fingernails, behind the ears, even as far as saying, has your hairdresser ever mentioned that they see a mole in your scalp, because most of us, I can't see the back of my scalp, but especially in our area, with the predominance of skin cancers, definitely want to do yearly screenings, especially if you have multiple moles, and then do self-examination and list the services of anyone who's near you, who's around you enough that would see a change in any moles on your skin. And I also place some resources here for places to get more information. With regards to diagnosis and treatment, so once you've been diagnosed with a skin cancer, whether that's a basal cell carcinoma, a squamous cell carcinoma, or a melanoma, the first step is one, the diagnosis, and that usually is going to happen by excision biopsy, where they remove the mole or the area. Well, what first happens is something called dermatoscopy, where they actually look at the mole under a microscope and they assess those A, B, C, D, E. So the asymmetry, the borders, the color. If they find it concerning, they'll do what's called an excisional biopsy, where they remove that area and they send it to pathology. The pathologist will be able to say, this is a squamous cell carcinoma, it's very superficial, it's been removed, just follow up. Or it's a basal cell carcinoma, and there are still some areas that need to be excised. Usually you'll be referred again to dermatology and they'll do another excision or have you see plastics depending on where that mole occurs. And if it's a melanoma, they will stage and see, okay, is this limited just to the area? Has it infiltrated to lymph nodes? Is it metastatic? And then there'll be a team of doctors, dermatologists, dermatological oncologists, radiation therapy, whatever is needed to help to, one, remove the lesion and then provide systemic treatment. As I said, one of the things that I really tend to harp on is prevention, and knowing the signs, knowing when to walk, knowing when to run, right? Knowing when to escalate something to your doctor, to your dermatologist, to seek more help. And I think that it really behooves us to kind of keep an eye on our bodies, listen to what people are telling us and what our bodies are telling us, especially when it comes to those skin affectations. And then prevention is key, protecting yourself from the sun. So I'm going to stop there and turn it back over to Brooke.
Well, thank you so much, Dr. Guerrier. That was super insightful. Before we get to our Q&A, we just have a few tips and laws for walking safely in the spirit of prevention. Walking is one of the activities that the Long Island Health Collaborative promotes as a way to combat, a lot of chronic diseases and conditions. So we just like to bring your attention to these tips, as Long Island has one of the highest incidents of pedestrian injury and fatality. So when you're walking, always use the sidewalk. If there is no sidewalk, always walk facing traffic. That is actually a law in New York State. See and be seen, wear brightly colored clothing, carry a flashlight when you're walking at night, make eye contact with drivers whenever possible, cross streets at corners or in crosswalks, and don't text or talk on your cell phone while you're walking. It can be just as dangerous as doing that while you're driving. And of course, when you're out there walking, please remember to wear SPF. That is not a New York State law or, a tip that we typically provide, but certainly when it comes to prevention of skin cancer, SPF is key. So, and now we would like to take any questions you may have. Please feel free to unmute yourselves, put your questions in the chat. We would love to hear from you.
And I did just want to add, when you say you've SPF, so a common question that I asked is, well, how much SPF is enough? When should I use it? And to be honest with you, anything greater than 15, so I tend to tell folks between 30 should be the starting point. And don't, you think that, okay, I applied this SPF, so now I'm invincible. You know, you want to make sure that you're reapplying in a timely fashion, that if you're going into the water and coming out, you're reapplying, that you're still protecting your skin, even though you have the SPF on. There's a recent study that showed that, you know, folks that use a higher SPF, you know, I think will tend to behave, it influences their behavior and saying, okay, I have an higher SPF on, so I either don't have to reapply as often or I can spend more time in the sun. And that's actually not as true. You want to continue to apply the SPF, especially if you're, you know, sweating or getting in and out of the water, and you still want to protect your skin with protective layers when at all possible.
That's great to know.
May I ask a question?
Please do.
With a low vitamin D level, they advise getting sun. So will I still get sun if I stay out just 20 minutes with the sunscreen on?
Yes, absolutely. So I would say, you know, you want to limit your time. Like if you're going to be getting sun between 11 and 3, 20 minutes is fine. Use the SPF. And, you know, it's not only going to help with the vitamin D, which I think is awesome, it's also going to help just with overall mood, endorphins, so on and so forth. So 20 minutes at a time should not increase your risk. And you should still be using the SPF. Even though you use the SPF and it's blocking the UVA and the UVB rays, your body will still be able to metabolize and use that vitamin D.
Thank you.
Sure.
I have a question regarding, you know, there are a lot of products now that, you know, like concealers and moisturizers that do have SPF in them. And like the ones that I've seen, actually, the level is less than 30. So that I know, you know, I need to up that. But so with those products that contain the SPF, do you feel they are as effective as, you know, applying a layer of pure SPF, say, you know, just like a basic sunblock before your makeup?
So I don't think that they're enough, because they're usually less than like 10, between 10 and 15.
Mm.
I would say there's some kind of because some of the SPFs are very thick, so to put them on before the makeup kind of can actually cause, you know, pimples and so on and so forth.
Sure.
So there's some like mineral based sunscreens that are about 30 that you can apply before you put on your makeup, and that's what I'd recommend, especially for the face, and then for the face and neck, and then for, you know, the rest of the body, just regular SPF.
It's great to know. Thank you. We definitely have time for any other questions that attendees might have. In the meantime, I am going to launch our post-event poll questions. If you would be willing to give us some additional feedback now that you've heard Dr. Guerrier's presentation, we would love to hear from you. And if you do have any other questions, please feel free to unmute yourself or put those in the chat. And I see answers coming in. Thank you all so much for taking the time to answer those questions. And while you are answering those, I will just remind you that we do have 3 more Talk with a Doc sessions coming up before the end of June. And at the end of each month, Saturday, May 27th and Saturday, June 24th, we do have 2 Walk with a Doc events coming up as well. And we would love to see you there. I'll give it maybe 10 more seconds on these poll questions, but I do just want to once again thank Dr. Keasha Guerrier so much for her time, her insight. I always learn something new from you when you speak to us, so thank you so much. And of course, many thanks to AARP and Rosa for joining us today. And to everyone in attendance, how could I forget you? We couldn't do this without you. So thank you to everyone who took the time to join and listen this morning. We really appreciate your participation. So we're coming up on 2 minutes here. I think I will close the poll. Thank you all so much for your feedback.
There is a question in the chat that
Thank you
says
so much.
a PET scan, any do's or don'ts. Can I just ask you to unmute yourself, Ms. Rebecca, and just to elaborate in terms of the do's or don'ts, so I can answer that question a bit better.
Kim, if you're able to unmute yourself, that would be wonderful.
So I would say, so PET scans are a very specific test, and I'm sure there's a slew and litany of things that you were given to read and do prior to the exam. Okay, got it. I gotcha. So what I would say is, depending on what medium they're going to use for the PET scan, there's going to be a lot of specificity around, when's the last time you should eat and drink prior to the PET scan, and then what your activities should be afterwards. So I would say in the days and weeks prior to the PET scan, general advice, right, to stay as healthy as possible, stay as hydrated as possible. I'm really going to kind of harp on the hydration piece, because with the PET scan, you are injected with a radioisotope that doesn't necessarily damage parts of the body, but you want to be able to flush that out of your system quickly, and you want your kidneys and other organs to be able to, be in their optimal state prior to getting that radioisotope. So I think with regards to just the general things, keep yourself healthy, keep yourself rested, and hydrate prior to doing that PET scan. You don't have to stop your vitamins prior to the scan. You can continue taking those. I would say just in the 24 hours, or not even, I think 12 hours prior to your exam, your doctor may ask you to be what we call NPO, or nothing by mouth, 12 hours prior to the exam. And so you should either take your vitamins earlier that day, so that you can fit into that time frame where you have to be fasting. But you're good with medications and vitamins prior to your exam. But as I said, continue to try to keep yourself very hydrated prior to the exam and immediately after. Once you're cleared to eat and drink as normal, try to flush out your system, with, fluids, water, and so on and so forth. You're more than welcome.
Getting a lot of thanks in the chat. So thank you all so much for your time.
I would like to say something.
Please go ahead.
Okay, Doctor, I really appreciate this session. And there was like a lot of things in this short period of time that I was able to take home and to actually share with people in terms of this, because when you mention it between the fingers, behind the ears, on the scalp, I mean, these are places that are usually not looked at, or even on the legs, they're not looked at. So it's something that when I go to the doctor, I'm going to ask, to please check these areas.
Absolutely, absolutely. And, in the nail beds as well. And again, like as I said, enlist the services, even of your hairdresser. Like, are you seeing anything in my scalp? Or for men when they're getting their hair cut, definitely, enlist the people that are kind of, around those parts of the body, right? So if you get regular pedicures and you have a nail technician, are you seeing anything in the nail bed? Because I'm guilty of that as well. I don't spend a ton of time like looking between my toes or at my toenails. So absolutely.
All right, well, if there are no further questions, I think we are going to wrap up today's talk. Once again, thank you all for your time, and thank you, Dr. Guerrier, for your expertise.
It's always a pleasure, and thank everyone for attending, for your questions, and look forward to chatting again soon.
Thank
All
you.
right, well, have a great afternoon, everyone. Thank you again.
Thank you.